Okay, we will go ahead and get started. Good afternoon, everyone. I'm Sarah Ross, the Program Manager at Erie County Economic Development Corporation. Thank you for joining us for our business check-in that we're doing throughout this COVID-19 unprecedented time. A few housekeeping items before we get into our agenda. We can take audience comments and questions through the Q&A, so feel free to submit there throughout the program and we'll get to as many as we can. The webinar is being recorded and will be available to you along with the slides following today's program. We'll send that out later today. So we've got a full agenda for you today. I'll kick us off with what's changed. Then we're going to hear from Michelle, who is with Governor DeWine's office. We've got State Representative DJ Swearingen on the line, who's working on the Economic Recovery Task Force there in the House. He'll give us an update there. And then Eric Wubser, the City Manager for our county seat, City of Sandusky, will give us a little bit of the local government perspective. And then our favorite returning crew member, Abby from the Erie County Health Department, will talk to us about some of the recent updates there from the health perspective. So again, if you have anything chatted in through the Q&A, we will have designated time for that at the end, but chat them in throughout so we can be ready for that when it comes. So I'll kick us off today. One thing I want to just briefly mention, that Paycheck Protection Program through the SBA, that second round did open up and is still open. You are still able to apply for that. One thing I especially want to note is for people that didn't have an existing banking relationship, banks are now starting to take on new clients to apply for that. So if you haven't applied for that, you haven't gotten underway with that and you're interested, feel free to contact our office for help with that, but it is still open. There is still funding available this time around. A quick update from our office, which you heard about last week. We hosted a RISE Small Business Innovation Grant over this past week. And I just wanted to share with you guys that we received 61 applications from small businesses. And a quick takeaway from that is it truly is inspiring to see all the business owners and business leaders who are looking at this as an opportunity. And even though it's a challenge and it's still not easy, there are opportunities here, and it's really a great time to re-examine your customers' needs. And it's really inspiring to see how some of your companies, no matter the size, are doing that. So we really appreciate that. And we look forward to working with all of those applicants and the grant winners, which will be announced next week. So if you need help talking about your opportunity, also, we're here for that. So the big news that came out this past week is the Responsible Restart Ohio plan. And I'm sure we'll hear a lot more about that from Michelle with the governor's office. We've got 3 phases of opening, and there's a lot of guidance out there. So if you haven't seen the sector-specific operating one-sheeters, those are available on coronavirus.ohio.gov. The whole plan has brought about a host of new questions. So that's primarily what we'll cover today. And if you need specific one-on-one help with that, get in touch. One of the most common questions we have received, not necessarily specifically relating to Responsible Restart, but just about restarting in general, is what should I do if my employees don't want to return to work? So there's no easy answer for this, but we do know that kind of the burden of communication and preparation for business owners and leaders is a two-sided coin. We not only have to manage our consumer confidence, but also our employee confidence. So just kind of going back to what our guest speaker, Kula, said last week, really the best we can do is set and communicate clear expectations. So that's going to be one of the challenges that we work through together. So we're here to help you with that. We're here to help you with the restart. And so we're going to try something new this week, just so we can hopefully better help you with the restart. I have a quick 2-question poll. It should be popping up on your screen now. So we have two questions we want to hear from you guys. If you're on your computer and you can answer, what's your primary concern in planning for your reopening? Is it abiding by the health and safety regulations? Is it your staffing, consumer confidence, or capital needed to restart? And then are you having trouble procuring any of the following PPE: face masks and coverings, hand sanitizer, disinfecting, protective shields? So let us know. We'll keep that going. We really appreciate the input, and this helps us pick the content for these webinars, for our emails that you're getting, and then we can also contact you directly to discuss any of these needs. So I'll keep that open for a little bit, but we want to hear from you so we can better serve you. That's pretty much my update. So now I'm going to turn it over to Michelle Gilchrist. She is joining us from Governor DeWine's office. I've got you unmuted now, Michelle. She's joining us on the phone. So again, chat in your questions on the Q&A and I will monitor those. But Michelle, you are up.
Great, thank you so much, and thank you for inviting me to be with you today. As of last night, near midnight, the Director of Health new Safer at Home Ohio order was signed. That is up on our website, coronavirus.ohio.gov, and it is written as clearly as we can possibly write it, and it goes into the different industry sectors that are starting to reopen, the healthcare sector being the first one that's opening today, and then the general office environment, and also the manufacturing, distribution, and construction sectors that were not open already are reopening on May the 4th. And then on May the 12th, the retail sectors will be opening. Also found in that order are the various guidelines in terms of reopening, the safety guidelines, the guidelines regarding social distancing, the hand sanitizer, and also the wearing of masks, plus the 6 different exceptions as to why a business would not be required to have an employee wear a mask. Today at the governor's 2 o'clock press conference, which I encourage all of you to watch, he will be going into much further detail about this new order. And I'd also like to point out that every stay-at-home order that's issued has to have an end date. So right now, the end date is listed as May the 29th, but recognize that these orders can be amended within that certain period. So while you're not seeing certain things listed on there as being able to reopen, we do have a variety of different working groups from those different industry sectors working on potential guidelines for reopening such sectors as restaurants and bars and hair salons and other types of recreation and entertainment services. So stay tuned for more information on that. The one thing that is going to help with all of this is the fact that the state of Ohio took it upon itself to sign a contract with a testing manufacturing company that most of our healthcare institutions in Ohio work with. And so in the next few weeks, we will be able to go from about 3,200 tests a day to about 20,000 tests a day. So the more individuals that we can get tested, the better understanding that we will continue to have of what the numbers look like in Ohio over that 5 to 10-day period that both the health departments and the state health department and the governor are looking at to make sure that hospitalizations are not increasing at too much of a rapid pace, and also taking a look at the deaths that are happening as a result of this, which tend to lag behind 3 to 4 weeks from the initial diagnosis. The last thing I wanted to or two last things that I wanted to cover is that I know PPEs are a concern to a lot of people with their reopenings. The state just sent 4.1 million PPEs to your local emergency management agencies. So if you're looking for PPEs and you can't find them through your local or your normal distribution channels, you may want to reach out to your local EMA and see if they can assist you in any way. And then lastly, I know this deals more with local government, but the function of local government also impacts the function of the local economy and the business community. We are still at the state level working with the Ohio General Assembly to come up with the most fair distribution formula to get some of that CARES Act funding down to local governments to help with their increase in costs due to the coronavirus. Unfortunately, given the federal guidance on this, local governments will not be able to cover their revenue declines as a result of this. We are working diligently with the Department of Treasury and with the U.S. Congress, encouraging them to have more flexibility in these funds and any future funds that may become available for local governments. So at this point, that is all I have for my update, but I'll remain on the call for any questions.
Thanks, Michelle. I do have 2 questions we can probably address quickly, and then we'll see what else we receive prior to our Q&A at the end. But one of the questions regarding the stay-at-home order, how is it written if you need to leave to support the businesses that are open? Is that one of the exceptions in the order?
Yes, that has always been an exception to the order. So, for example, the business that and if I'm not addressing this in the right context, let me know. So the business that my husband's involved in was deemed non-essential, but you could still leave the house to check on the status of the business, maybe the security concerns of the business, things like that, which he would do, once a week. So I don't know if that is what the question was trying to get at.
And then just in regards to supporting like the retailers that will open kind of in the third wave, consumers.
Yeah, so if you're a business that maybe supplies that retailer, or you clean that retailer's business, yeah, that would all be something that would be deemed necessary in order to get that business up and running.
Great. And then are there downloadable and or printable materials for businesses to post about safe guidelines on that coronavirus.ohio.gov website?
In terms of like the safety rules and things like that, yes. And what I can do is I can find that link and send that to you. So maybe you can post it on your website or send it out to maybe the folks that were on this call.
Great, we'll do that.
Okay.
Thank you. Well, we'll keep collecting questions for Michelle after, but we really appreciate you being here and your support and openness for us to reach out as we have questions.
And then if I can just take 1 second, let me do this. For those of you who don't have my email, I can either give it out now, or if Sarah, you can send it out if you'd like.
Yeah, we'll do both. So if you don't mind sharing now, and then I'll include it in our follow-up.
Okay, it's Michelle, so MICHELLE dot, and the last name is spelled G as in George, ILLCRIST at governor.ohio, and Ohio is spelled out OHIO.gov.
Great, thank you. All right, now we'll hear from DJ, who has been on one of our calls before, so we look forward to his follow-up. I think I unmuted you, and you.
Okay. Thanks, Sarah. I appreciate it. And for those of you listening in, 2 updates. One, we are going back into session next week, May 4th, which is it's just good to get back to Columbus and start addressing some of the issues that are out there for workers and business owners in our communities. Over the last 3 to 4 weeks, I've been a part of an economic recovery task force that Speaker Householder put together in the House of Representatives to hear from workers, business owners, those who have been impacted economically by the health crisis. And we just wrapped up another hearing today. I think we are nearing the end of our hearings, and the goal is to take away what we've heard from those in our communities and apply them into actionable policy initiatives. Some of the running themes that we've heard, and these are generalizations, not getting into details, but some of the themes that we've heard, that businesses, need to get back to work as quickly and safely as possible. Obviously, in the interim, there are those businesses that have been able to get by, in a different capacity than they were before and still make revenue. There were some that, to date have been unaffected by this, but there are also many that have not been able to make any money. And we've heard from those groups on this task force. And, obviously from their standpoint, the sooner we can get back to work, the better. Businesses and workers also need certainty in terms of a timeline for resuming work activities. They need dates and plans so that they themselves can prepare staffing levels, inventories levels, anything along those lines, and be ready to go when the time comes. Several businesses have told us it's going to take a couple weeks lead time to get ready, even when they're permitted. So the more advance notice they can have, the better. Another thing we've heard about is some disparity where small businesses are closed down while maybe larger competitors have remained open, and the complaint has been that this is an unfair advantage in the marketplace. And the final theme is that businesses and workers, they appreciate the risk, the health risk involved. They want to get back to work, and they do want to do that safely. They're ready to do what is necessary to maintain the safety of their employees by following best practices and guidelines for the health and well-being of all involved. Some of the policy recommendations that have been discussed to date, in addition to seeing how quickly we can get back to work while maintaining the safety of all involved, is, for our restaurant bar owners, exploring flexibility in liquor permitting and fees. There are issues right now in our food supply chain that need to be addressed. Broadband internet has been a common theme as well that's been a concern. continuing to ensure that PPE production continues in Ohio, as that need's only going to increase as we go forward. Expansion of testing for COVID-19, making sure that any expenditure of state funds like grants or low interest loans are actually targeted to those businesses and industries that have been most impacted by the COVID-19 stay home orders. Another theme has been the strategic reshoring of manufacturing jobs and some of the supply chains back to Ohio. I think we've learned over the last couple of weeks that it pays off to have the ability to make things in your own country and state. So that has been put forward as an idea and a topic for further discussion. We've also heard about a lot of workforce issues presented, as parents going back to work. There are limited childcare options right now. So for workers, this presents a real problem in the sense of, I got to go back to work. What am I going to do with my kids while schools are out? Childcare options are limited. We've heard of a lot of parents electing emergency family medical leave to care for their children. So this presents disruption in the workforce as we move forward. We've heard positive feedback about the use of telemedicine, and we're looking at whether that should continue, and those changes to telemedicine should be made permanent going forward. Back to parents and kids, the online remote work for schools, going forward, parents and children have had an issue with having enough computers in their homes to get stuff done in a timely fashion. School assignments, in addition to workflow for the parents as they remote in, has been brought up. We've also discussed starting school after Labor Day and altering testing to accommodate the same. Starting school back a little later can give businesses a bigger window to recoup some of their losses, in addition to giving our schools enough time to make sure that they're safe and ready to go. And then there's been discussion of investing in strategic public work projects to stimulate the economy. So that's a short list of some of the things that have been discussed. Like I said earlier, we're really looking forward to getting back to Columbus next week to start putting some of this into action as we move forward, and look forward to working with all of you as well. So.
Thank you, DJ. Really appreciate those updates, and more to come as you get back in session.
Thanks, Sarah.
And Eric, thanks for joining on screen. And we'd definitely like to hear from you as to how things are going for the city and how we can support each other.
Thank you, Sarah, and thank you everyone for participating. I wanted to just start by thanking all others who are on the call, including ECADEC, for organizing this. We're really grateful for that. The update from the state, both the governor's office as well as Representative Swearingen, is really helpful. And to have the other small businesses, et cetera, that are participating on the line. We've heard a lot of similar things in Sandusky. I can give just a little bit of perspective of what we're going through and steps that we've taken. It's also great to have the health department on the line, and we've tried to do our best as it relates to the response to COVID-19 to really take our cues from the governor's office and the Erie County Health Department, because we know we're not the experts on that. And obviously, just as everyone else is hopeful that we can safely reopen and have a plan for that, we also want to make sure that we're doing that in a responsible way and not rushing it or doing it hastily so that we end up in a worse situation in the long run. We don't know those answers, and so we're trying to sit back and we hear from local businesses that are frustrated, as well as from those who are concerned for their health. And so we'll let the experts deal with that, and we'll control what we can control at the local level. We do have a great deal of sympathy for what small businesses are going through. Like ECADEC, we did a small business grant program for impacted retail and food and beverage type businesses in Sandusky, including fitness and hair salons. And we had, I want to say over 100, we made over 100 of those grants, and the grants totaled either $1,500 or $3,000, depending on the size of the business or the losses. And while that is a modest amount, we heard from a lot of businesses that it made a huge difference. So whatever other programs like what ECADEC is doing, or the state or others can do to really support small businesses during these difficult times, the better.
we made the decision to do that with some of our own economic development funding, in spite of the fact that we're facing, maybe on a per capita basis, the greatest impact of COVID-19 on our local budget in the state. That is because, we're a relatively small city at 25,000, but we are heavily dependent on a very large company, Cedar Point, that operates seasonally. 20% of our general fund, we have a $24.5 million general fund budget this year. Nearly 20% of that comes directly from admissions taxes paid by Cedar Point. And then the ripple effect of Cedar Point is huge in our area as it relates to the lodging taxes that we can collect, as well as the income taxes, much of which are paid by the 4,000 to 5,000 seasonal employees that they hire to get them through their season. Every day, obviously, that they don't open has a huge impact on our revenue and ability to provide services at the city, but also on all of those local businesses who, you kind of learn in Sandusky or in the surrounding areas how to get by. You do what you can in the winter to do kind of a hibernation of sorts, but to keep open so that you can be ready for spring and summer and fall to make up for those lean winter months. The timing of this pandemic is really difficult as it relates to businesses that were already probably tapping into reserves that did exist to get to those busier seasons. And so any help that can come, just to put in perspective what Sandusky is facing, our lowest estimates of the impact in our budget this year is that we'll lose approximately 22% of our budget, or nearly $5 million. Our highest estimates, which we're not even sure if it's truly the deepest that the cuts could go, which presume that Cedar Point would not open this year, have that number closer to 45%, or between 10 and 11 million of our $24 million general fund that would not come in as revenue this year. So that all being said, and I think this is important because we've heard statements made by the Senate President at the federal level and others as to whether local governments should be receiving any stimulus funding at all, is to say, we think Sandusky has done things the right way. And by the right way, I mean that as we passed a tax increase in 2014, when we were still feeling the effects of the 2008 recession, to sort of stem the cuts there, we have invested those funds wisely and conservatively. We've added to our reserve in each of those years. In fact, we carry a reserve that we will dip into this year of approximately 22% of our annual operating budget, which by industry standards is a strong reserve. And we had no idea that something could be this deep that we were facing. And so we're prepared for that. In addition to that reserve, and in addition to that revenue increase that we've recently done to deal with the last recession, we had also lowered the debt obligations. We have very little debt obligations for our general fund, and we've worked very closely to craft public and private partnerships to help trigger, $300 million in public and private investment to grow our tax base over the last 5 years. So when we hear comments that we should have been better prepared for this, they frustrate us. And also, we know that there are only so much cuts we can make. We've already cut over $3 million of our general fund budget. That includes eliminating 17 full-time and 2 part-time positions. I made the second round of those cuts today. So 7 people today learned that they no longer had jobs with the city of Sandusky that this morning did have jobs with the city of Sandusky. We've also suspended nearly entirely all of our capital budget and our economic development programs and our housing programs. Our entire management staff has taken a 10% pay reduction. All of our administrative employees have taken a 5% pay reduction who are not management. And the total of those savings and the elimination of those positions is a little over, I think it's around 3.1 million. And we will reserve spend this year, but we have been very careful to not include safety services who are dealing with COVID-19 out on the streets, as well as our most essential services. But we can't cut anything else without making a serious round of layoffs that are going to dramatically impact our ability to provide even essential services in this city. So anything that the state can do, anything the federal government can do, any creative solutions that exist out there, and we're not the only city that's in a difficult place, but because of this region's unique dependence on tourism and Sandusky as the location of Cedar Point and the revenue that it generates, we are probably one of the most at risk of anyone. And I'm sure the islands are in a very similar place because they have a very seasonally dependent revenue. And I guess that's just what I would say is as formulas are being created either at the state or the federal level, I think a population basis for that is not appropriate. I think that different communities are impacted in different ways by this. For example, those who, like our neighboring townships that depend on property tax, they're going to feel the impacts of COVID-19 in a much slower way than we're feeling it. We're feeling it at a month-to-month basis with highly elastic and impacted in real-time revenue streams. I hope there is some way to take that into account as any aid is being determined so that the help can go where it is needed the most. So with that, I'm happy to stay on and answer any questions or have further dialogue once we get through the rest of the presentations. But that's where we're at today. I will say that's a pretty sober message that I am delivering. But I will close with the statement that we did the small business program, and that was $165,000 that could have been cut in savings for our general fund because we knew our small businesses needed help. And we have done a series of sort of community building and rallying actions over the last several weeks because we are resolute that we're not going to let we're not going to let the progress that we've made over the last 5 to 7 years in our community be taken out by this crisis. So we're going to stay positive. We're going to stay optimistic. We're going to keep working with those in the public health community to ensure that we do everything to reduce the impact of this crisis on our area. But we are in a difficult situation and we do need all the help we can get. But we're proud of the partnerships we've forged, and we think we're a really resilient community that will come out of this, but are anxiously awaiting when we can reopen and are anxiously awaiting help, being on the way. So thank you.
We really appreciate you leading by that example, Eric. Very similar position to what our businesses are in, having to make really tough cuts and tough decisions, but also stick to your values and priorities and get creative around them. So very relatable, hopefully, to many of the people on the line. And we're all in this boat, not easy decisions. So thank you, and we'll definitely keep that in mind and as we work together with you.
Thank you.
And yes, we definitely appreciate you staying on for questions. Okay, Abby, our Public Information Officer from the Health Department, I'll stop share your screen.
All right, hello. Thank you for having me again. I think that these check-ins are really good and they're a really great opportunity for us to get some information out there to the public about really what's going on and what the status of the situation is in our community. And so as of this morning, we have a total of 55 laboratory confirmed cases of COVID-19 in Erie County. We have 12 probable cases. And so that's a total of 67 cases in Erie County. We've had a total of 17 hospitalizations. That's cumulative, so they're not all currently hospitalized. Some of those individuals have been discharged. We've had a total of 3 deaths, and those were all laboratory confirmed. And then you can see the state numbers here. This is our dashboard. You can find it on coviderieohio.com. It's updated about twice a day. That date is not correct. I'm sorry, I forgot to update that. So that's this is as of this morning. These are the correct numbers. One of the big things that when I talked to Pete Shade, our health commissioner, about what he wanted me to talk to you folks today about, it was really to emphasize that the virus is still in our community. It's still just as dangerous as it has always been, and it's still spreading, and it's very communicable, it's very infectious, and it's still there. And so as we start this process of reopening, we just need to make sure that we are doing it in a responsible way. And we're here to help, and we're here to provide that guidance so that we can do that in a way that keeps everybody safe. Because if we get to a situation where this virus gets away from us, and it starts really spreading uncontrollably throughout the community, all of this will have been for naught, and we're not going to be, our businesses are not going to fare very well in that situation either. And so we're just really want to provide as much support as we can to keep people safe at this time. A little new information that we haven't really released yet to the public, but I wanted to share with you folks today was the demographic breakdown. And so sex, 60% female, 40% male. Race is one that we're very concerned about. And so you can see here that in Erie County, 38% of the cases are in African Americans. And so African Americans only comprise about 9% of the population in Erie County. So they are very much disproportionately represented in the COVID-19 cases. And other refers to individuals who are mixed race, essentially. So that really is also African Americans in our community. So that's very much disproportionate to what our demographics are in the county. And that's something that we're working on, and we're trying to track down and figure out the reasons for that. And then also the age ranges here, you'll notice we have folks all the way from 4 months is our youngest case in Erie County, all the way up to 93 years was our oldest case. So the Responsible Restart Ohio, that plan has been rolled out, and we did finally get the final wording on the plan last night when it was signed. And so the timeline here with May 1st, today, different medical offices are able to open, dentists, veterinarians. May 4th, so on Monday, we'll be able to open those general office environments, manufacturing, distribution, and construction. And then on the 12th, they are allowing consumer and retail services to open. The health department is reaching out to all of these businesses personally and providing individualized guidance about reopening safely. And so if you haven't heard from us yet, you will be hearing from us. I know they were out, our sanitarians were out yesterday, and they're out today also hand delivering guidance, reaching out to people, and providing that information. There have been questions about enforcement of the order. And so in the order, the language states that the local health department and state and local law enforcement are given that job of enforcing the policy. And so it is a misdemeanor of the second degree, which could include a fine up to $750 or up to 90 days in jail, or both, for violating that order. Now we're not out here to try to arrest people or anything like that. Our job is to provide guidance and to help people. And so if you see us come in, our folks wear these bright yellow jackets when they're out in the community. We're there to help. We're there to provide you information and advice and to help us stay safe and get us back on the road. So this is only going to be, these penalties are only going to be enforced if there was something that, somebody really flagrantly is choosing to put people in danger. Would we consider working with law enforcement to do that? We have shut down businesses since the stay-at-home order was initially issued. We did shut down, I believe, 2 different businesses that were deemed not essential. And so we're not afraid to do what we need to do, but our goal really is to work with people. We're not coming, to put the hammer down on people. We want to really work with people and see what we can do to keep people safe. I know there's been a lot of talk. This has been, I feel like, the topic of the week is facial coverings. Everybody wants to know who is required to wear them. And so, Governor DeWine has kind of waffled back and forth on this, and there's been different guidance released by the Ohio Department of Health and the state over the past week with different wording. And so the final word in the order today is that businesses must require all employees to wear facial coverings, except for if they fall into one of these categories. And so if you look at the wording of the order, you can figure out if that employee needs to wear it. And so, for instance, I'm in my own office here, the door is closed. If you're working alone in an assigned work area, then that person is not required to wear a mask. But if they leave the office, walk to the restroom, walk to a community area, then they need to be wearing a mask at that time. So, I know there were some questions about that. And if it's, for medical reasons or reasons like that, then again, they are not required to wear it if they have a medical condition. And then facial coverings are not required for customers or clients who are entering a business. And so there was a lot of chatter on Facebook yesterday about, they heard that we were requiring, temperatures for customers upon entering 7-Eleven, and it was a whole big deal, and that's not true at all. So we're not requiring face masks. We don't require temperatures of customers to be taken. We do recommend that employees have their temperature taken, or that they take their temperature at home before they come to work, and they need to be monitoring their health. But the temperatures for customers are not required or even recommended. And of course, we are going to continue providing information. If you have any specific questions about reopening your business safely, you can always call our Erie County COVID-19 Information Center, and somebody there will be able to either answer your question or direct that to the correct person who will give you a call back and answer your question. Also, coviderieohio.com, that is our dashboard, but there's a lot of great resources and information there as well. And so you can always visit that website to get information. And yeah, always reach out. We're here to help.
Great, Abby. If you don't mind, 2 questions we've received in advance. You mentioned that masks are not required for employees if there is a medical reason. Are they required to have a doctor's note for that?
I did not see, it doesn't say in the order that they require a doctor's note, but the business does need to be prepared to provide in writing justification if an employee is not wearing a mask. They may need to provide that justification to us as to why they're not. And so an employer may decide, they can make that decision themselves if they're going to require the employee to provide that medical note.
Okay, great. Thank you. That's helpful. Sorry, looking through the questions here. Just being in the area we're from, we have a lot of questions about hotels, motels, and campgrounds. Where do those fall?
Yes, so we're getting a lot of questions about campgrounds and RV parks and that sort of thing. And so we have gotten more clarification on that, and in the order it does clarify more clearly what is allowed and what is not allowed. And so if you have an RV or a camper of some sort, and you have a lease or an agreement that was in place prior to the stay-at-home order, and that RV can come and go, but that agreement needs to be in place, that a long-term rental agreement of a space, that is allowed, and you can come and go as you please. However, the weekender camping one time, one weekend, that is not allowed. And so it's that transient camping, for folks that are just traveling for a weekend or, a couple days, that is still prohibited. But again, if it's either a permanent structure, or if it's if it's on, it doesn't have to be on a pad or anything like that. Just as long as there is a long-term rental or lease agreement in place, then folks are allowed to use that.
Great. So this has been chatted in twice, and you did answer it via chat, but I'll just share with the group. Someone asked, as employers, requirements to do temperature checking on site, or can an employee do self-evaluation? And you said temperature checks for employees are a recommendation, but not a requirement. Having an employee perform the self-check is a reasonable solution to the problem.
Yes.
Okay. Any other questions, folks, for either Abby from the health department, Michelle from the governor's office, DJ, our state rep, or Eric from the city of Sandusky? Chat them in now as we are wrapping up here. Let's see.
I'm seeing one about the symptom collector. Do you want me to
Yeah,
address
go ahead.
that? Okay. So I'm glad that somebody asked. So we have this brand new software system that we have implemented. It's the first in Ohio. It's the second in the country. And it is a symptom collector. And what it is, it's going to allow us to conduct comprehensive, syndromic surveillance. And so individuals can go on to that covid.erieohio.com, and there's a section about symptom collector, and you can click on that and you can enter your symptoms, and it, with your permission, it will allow us to see where your location is. You can enter your location and we'll be able to track the spread. So we know that there's a lack of testing. We know that's been very well documented throughout not just our county, but the state, the country. There are not enough tests. And so we can't reasonably identify all of the cases of COVID-19 in our county. But what we can do is we can track this activity, this syndromic activity. So most people, when they get this, are going to be okay. We know that. They're going to ride it out at home, and it's gonna stink. It's gonna be a very bad flu, but most people are going to recover. But we may never have tracked that. We may not have any indication that that even existed, that that person had it. And so by using this syndromic surveillance tool, they can enter their symptoms, and we can track where the virus is spreading in our community. And that's going to allow us to really be able to provide more resources to, track unusual activity and figure out, how we can contain the virus and prevent it from spreading further, how we can, divert resources such as, maybe mobile testing or other, types of resources to that area to prevent it from spreading further.
Thank you. Okay. So people are asking about PPP in Erie County. We will send our emergency management contact, but then also just some other resources, PPE, sorry. We'll send that contact in the follow-up. Question, with contact tracing being implemented, what is a business's responsibility to monitor employees and customers?
So for contact tracing, we do contact tracing here at the health department. So when we identify a person who's a positive case or a probable case, we interview that person, or if they are indisposed, we interview a very close family member, and we identify who their close contacts are. Close contacts would be household contacts, anybody who has spent an extended period of time within very close distance of that person, and we get their information. And we contact all of those people and we let them know, hey, you have been exposed to the virus, and they are then required, and this is mandatory quarantine, they are required to quarantine for 14 days. This is enforceable by law, and they are not allowed to leave their home for 14 days. And during those 14 days, what happens is somebody here, one of our nurses, will call them every day, and that person needs to be monitoring their temperature morning and night. And we'll call them usually one time in the afternoon and get their temperatures from the morning and the afternoon. And we need to monitor their temperatures. So these are people who are well, who don't have symptoms, but they still must quarantine for those 14 days. And if they begin to develop symptoms, then at that point, we will move them on to testing. And if they don't develop symptoms within the 14 days, they get a letter from us releasing them from quarantine, and then they are free to resume normal activities. But that's how we do contact tracing. And so, we have a whole staff of people here that are doing that. We have wonderful epidemiologists that is what they spend their days doing. Up until, I don't have current numbers, but last week, about a week ago, we had 115 people in Erie County who had been put on quarantine due to the coronavirus. And so 115 people, and I'm sure it's many more by now. But it's not something, it's not scary. We're nice, we give a call, and and then, once it's all over, you can be on your way. And most people are very, very understanding. They get it, they understand, and they're fine.
Great. Okay, well, I have 3 more minutes and 3 more questions, mostly for Abby. So I guess it's a good thing we had you wrap things up for us today. So face coverings, you talked about when an employee is kind of in their private office area, but translating that to more of a manufacturing setting. An employee on a machine center with no one in the general area. Can they remove their masks there? And then if they walk away, for example, from the press to the restroom?
Yeah, so we've read it and we've interpreted it as if you're in an assigned area and there's nobody, within the general area, then it is okay to take off your mask. But if you leave your assigned area or anybody were to come into that area, then you need to put on your mask again.
Thank you. You spoke about the symptom tracker. Is that something you recommend we share with our customers and employees, and how?
Yes, absolutely. In fact, I've created a media toolkit, which you can find on that covideerieohio.com. And there's in that media toolkit for the symptom collector, we have all kinds of Facebook posts, Instagram posts, Twitter posts, and different website banners and ads that you can use if you were able to post it onto your agency's or your organization's website and share that within the community. We would love that. We want that to get out to as many people as possible. So yes, please share it.
Great, and we'll link that toolkit in the follow-up. And then last question from Larry Fletcher at Lake Erie Shores and Islands. Are you aware of the charter fishing options now available? However, there's been nothing official released on this from the state. It's basically any direction from health department on charter fishing now being allowed.
So as of now, outdoor recreation is not permitted. And so that is something that we would say is not permitted. That's based on our interpretation of the order.
Great, thank you. All right, so we have a lot of good documents to follow up with you on. Looks like we are, Eric, did you have more to add?
No, just.
Okay. We are planning our next webinar for 2 weeks. I believe it's May 15th. So we'll take a break next week. So we have some comprehensive updates for you in about 2 weeks. Thank you so much to all of our panelists and to all the valuable questions. There's a few of you we'll follow up with directly after, and we hope you'll join us again soon.
Thank you.
Thanks, everyone.